Good morning. My name is Eileen Houston Stewart. I'm the Director of Communications for the St. Joseph School District. Just to kind of give you a little idea of what we're going to do here. We have the agenda, so we'll follow the agenda, and then we'll open it up for question and answers. And we have our board president here, Ms. Tammy Pasley, so if you have questions for the board member. And then after we're finished, if you have individual questions that you would like to ask any of the people who spoke, then we'll just pull them aside and you're welcome to interview any of those individuals. So at this time, I'd like to introduce our superintendent, Dr. Douglas Van Sile. Dr. Van Sile.
Thank you, Eileen. Thank you for coming this morning. These past several months, if they've done anything, I think they have served as a reminder of the vital role that our public schools and that our staff and educators play in ensuring the equitable education for all of our students and how we support our community. Schools create conditions that develop students by helping them with their academic advancement, developing their social skills, exploring their creativity, finding things that they are passionate about, and by providing opportunities for them to pursue interests and activities. Reopening schools in a manner that is responsive to the needs of our families and our community will involve changes and flexibility to factors we may not yet know. The St. Joseph School District has been working to prepare numerous scenarios and will adapt to the changes that may still come our way. It is imperative that we model the same creativity, resilience, passion, and willingness to grow and learn that we expect and want for our students. This plan has been developed with the guidance and in partnership with local health organizations, medical professionals, and other professional organizations. We have gathered input and feedback from our students, staff, parents, and community members to try and make this plan as responsive and as clear as we can make it. We work to make this guide and protocols align with the best information that we have so we can strive to support our students, staff, and families as safely as we can. I greatly appreciate all the efforts from everyone who's been involved in this challenging process. We realize that not everyone will be happy or satisfied with everything that is in this plan, or that they feel may be missing from this plan. However, the St. Joseph School District is trying to do what is right for our students, staff, and families. We realize this has been and will continue to be a difficult time for many. We stand ready to help and support in whatever way we can. Please also know that this plan is likely to change between now and when our schools may reopen. As more information becomes available, and as we continue to follow the latest guidance of the public health officials, we will continue to update you and notify you as our plans change and develop. With that, I will turn it over to some of our folks who've worked on this plan to continue to explain what's there. And again, we appreciate everything that our staff and our administrators have done and the patience and support that our community has had with us. Thank you.
Good morning. I'm Dr. Marley Williams, the Assistant Superintendent of Academic Services. I'm not going to go over all of the specific bullets in the reentry plan. What I think is most pertinent and what I would like to introduce on behalf of Academic Services is our St. Joseph School District's Virtual Academy. A significant amount of work, time, energy, vision, and passion has gone into the work over the summer in creating a comprehensive group of K through 12 classes, and these have all been designed by our teachers. I want you to understand that this experience in virtual learning looks much different than the experience our students and our families had in March, April, and May. At that time, we had about 48 hours to prepare for school closure and the transformation of learning from face-to-face to remote. This time, we have had about 2.5 months. And while that time frame is really short, the work is high quality, and we have received significant positive feedback. So much so that as of Friday, Missouri Western agreed to allow us to use dual credit courses through our virtual academy. So that is a fantastic partnership for our community. If If you have any questions about the Virtual Academy, of course, there will be more information and we can share with you the previews after this news conference. But I would like to reiterate, this is not a fallback plan. Virtual education is something that has been in development and has existed in education for many decades. It has taken off in the last few years, and this is a significant step for the St. Joseph School District. So even after the pandemic has subsided, I do not foresee the Virtual Academy in the St. Joseph School District disbanding. Thank you.
Good morning, everyone. I'm Maria Burnham, the Coordinator of Health Services for the St. Joseph School District, and I will not be going over every single bullet point either, but what I would like to share with my parents and my families and our students and our staff are just some things that I feel are very important as we come back together in August. And that being said, one of the main things that we want to share is that communication will be very important between parents and our school staff, whether it be our nurses and our school secretaries. And so the big ask will be for us, to students and families that are coming back for the traditional school in the classroom, is that if you are sick or exhibiting signs or symptoms of COVID, to please stay home. Now, this isn't anything new, really. We ask that students and staff stay home if they are running temperatures greater than 100, if they have nausea, vomiting, and or diarrhea, just those yucky things people should be staying home for anyway. We will continue to share out the list of symptoms in regard to COVID-19 to our families so that every morning they can begin the screening process at home. They can begin to check their children and themselves for any signs or symptoms of illness way before the kiddos even get to school. So that is one way we are going to be looking to assist in prevention, and to the best that we can. We know it's going to be a difficult task, but we are up for it, and we want to partner with families to help keep the spread of illness down. As of now, today, the Department of Health and Senior Services is requiring all students needing immunizations to get them. Okay, it's very important to know that when those kids come August 24th, they will still need their immunizations. And that's going to affect our kindergartners coming in, our students going into the 8th grade, and our students entering that senior year of high school. And know that with us having a nurse in every building, we will continue to share information out as we get closer. And again, remember, this could possibly change between now and August 24th. Know that students who are sent home for illness as we go forward will be asked to stay home for 72 hours until we can kind of get some information as to a little more investigation as to what is going on in regard to their health, okay? The nurse in that building, again, will be speaking with parents and families to gain more information and learn what is going on with this student. And then, again, students who are diagnosed with COVID-19 or been around someone in the family must be symptom-free. They will be out for 14 days. We will follow CDC guidelines, DHSS guidelines, MSBA, DESE. We will follow all the guidelines, and we will work to get our students back as quickly as we can, but in regard to the health of everyone as a community. We will expect staff and students to wear masks when they cannot be a distance apart, that good social distancing. And for our littles, they're really recommending about 3 to 6 feet apart. So we will do more assigned seating, a little more cohorting, and things like that to help ensure the safety of all in our buildings. Biggies, you guys, I've talked to a lot of you out here. Biggies, wash those hands. Cover that cough and sneeze. We will have sanitizing stations around. We will allow time for proper hand washing. We will educate on hand washing. I know it seems so tiny, but it's huge to continue to teach proper hand washing, proper health etiquette, and things like that. And we will continue to do that in the classroom and through posters and various things like that throughout the school setting. A lot of other things, and I know there are others up here, so I'm going to stop there, and if you have questions later, let me know, and we'll help you out the best that I can.
I'm Dr. Robert Siegrist, Director of Student Services. A couple areas to talk about today: transportation, activities. Transportation, one of the things we've worked very closely with Apple to try to help formulate a plan. One of the important things for our families, we need to make sure that during registration you are checking the box or letting us know that you need transportation. We're going to encourage families to carpool, transport as much as possible. That will just limit the amount of exposure students have to each other. But make sure that you do let us know that you're going to need transportation. Part of that is that we're going to have assigned seating on all of our bus routes. We're going to do our best to fill routes from back to front to minimize that contact. We have to modify start and end times a little bit for schools this year. One of the reasons is that we're going to be disinfecting buses before and after routes. So we're going to have to build some time in for the bus drivers to be able to do that. The expectation is going to be that everybody has masks on the bus, including the drivers. The drivers will have hand sanitizer for when students get off the bus, so they'll be able to sanitize as they're getting on and off. And then Apple will be doing some regular, periodic, heavy-duty fogging of the buses, not necessarily every day or in between routes. They'll do the disinfecting and sanitizing. That's subject to change as they continue to follow guidelines and recommendations, industry standards there. 2 students per seat. I think I mentioned that, but there are going to be assigned seating, and we obviously will seat families together as much as possible too. Talk a little bit about activities. Activities could be pretty short in that we really just don't know right now. We're following recommendations from MISHA. We're going to work also with the MEC and the Suburban Conference with our schools. Hopefully, we're going to all be on the same page with that. One thing I do want to announce today, we met last week. The Missouri Football Coaches Association came out with recommendations that they don't do any jamborees this year. Last week, at the end of the week, we met all the high school principals and activities directors. We discussed that, and in our attempt to do what we think is best to try to make sure our kids have a fall season, we've decided that we're not going to do any jamborees this year. So we will not be doing a football, softball, soccer, volleyball jamboree this year. I know that's kind of disappointing. I tell people all the time that the jamboree is kind of the start of the school year event and get everybody in town together, and it's a great time. But at the same time, our end goal here is to do everything we can to find a way for our students to be able to have a fall season. Again, that's a rapidly changing area. We've done a great job this summer with our phased-in plans to be able to allow our students to be involved in activities and working out this summer. And so far, that's gone very well. At the same time, we're cognizant of area schools that are having issues with students testing positive in different areas. So we're aware of that. And so, again, this is a rapidly changing area. But hopefully, we'll know something within the next couple of weeks so we can start to plan that for the fall. But again, MISHA did put out some guidelines last week. They talked about Tier 1, Tier 2, and Tier 3 participants. Tier 1 obviously are the participants, are the student athletes, coaches, officials, the essential personnel that would have to be at a game. Tier 2 would be the media, and then Tier 3 would be fans at the games. And so, don't know what fall is going to look like, but there's a possibility, that we may look to some guides from MISHA there when they talk about Tier 1, Tier 2, and Tier 3. If you recall, at the end of basketball season, there were some events that MISHA hosted that were, the state tournament or playoffs, able to have it for the students, but there weren't any fans in attendance. And so I want to float that out there so that people are aware that that is a possibility. And again, our end goal is to be able to have seasons for our kids so they're able to participate in activities. So again, changing all the time, but we'll continue to work on that, and there'll be more information as we go. Thank you.
Good morning, I'm Chris Selcott. I'm the Director of Operations, and I'll be talking about how we prepared our buildings for the return of staff and students. All of our buildings have been deep cleaned and sanitized. They will be sanitized again before the students return. We have bought the equipment and the chemicals that's required to deal with the COVID virus. We have trained our staff, and we will continue to train all staff on how to use the equipment and the chemicals properly. Our staff that are the first contact with the public, there will be plexiglass shielding in place before school begins. We will be working closely between the custodial staff and the food service staff to collaborate with one another to make sure that the sanitation is done between the times that the students come to the lunchrooms. We provided adequate time so that sanitation can take place between the different shifts. We have prepackaged eating utensils that the students will use. Food will either be prepackaged or the food service staff will dish out the food. The intent is that the students will really not handle any of those things. And then finally, we will warehouse approximately 120 days worth of supplies, whether that be chemicals, face mask, anything that has to do with cleaning and sanitation. Thank you.
Thank you to everybody who's come up here and shared this morning. Hopefully people will take the time to go through the plan, make sure they read through it. There's a lot of information there. There's also pages that have frequently asked questions and answers. There is a way for people to go on our website, take a look at the information, ask a question that maybe already hasn't been asked. Please know that from a district vantage point, we really have tried to make sure we are covering all of our bases. We didn't get everybody up here to speak to you this morning. I know there'll be questions about special needs students. I'll just let folks know. Those folks should all be getting an individual call so that families can have a conversation with somebody in person, because we know that those needs are different from just maybe regular education students. We will continue to monitor all the information that's out there. We'll continue to supply updates and continue to update those frequently asked question pages as well. So continue to take a look at that. Between now and the start of school, which is still planned to be August 24th, a lot can change. A lot has changed just in the last few days. It continues to change on a regular basis. So please know that this plan is not set in stone. It is designed to be fluid and flexible, and we will make as many additions and adjustments as we need to along the way. So with that, I thank everybody. I think there's now a time for some questions. You can either ask me, or if another person needs to step forward and answer, we will do our best to answer those questions for you.
How difficult do you anticipate it to be to keep the children safe, to be able to have them follow the guidelines and keep coronavirus from spreading?
Sure. Well, the biggest thing for us right now is we need to know how many students and families will be coming back to school. That'll help give us some guidance and direction as well. That's why there is that opportunity for you to notify us as a family member by July 31st. That will help us plan. But that's a great question, because that's not how schools are really set up. Schools are set up to be social, collaborative environments. And so the challenge for us will be making sure we have clear and consistent outlines and expectations for our students. And then hopefully families and parents will partner with us to make sure that they explain to their students and their children what exactly that looks like. And then partner with us to keep reminding them of what that looks like. As Maria talked about, a lot of it is about wearing a mask if you need to, covering your cough, washing your hands, staying home if you're sick. Those are the biggest things that we can do right now. And then schools will do our very best to social distance and make sure that we are trying to keep kids apart. There'll be different things that we do, such as there won't be individual or no longer group supplies for kids to share and touch. We'll be using individual items. Specials will have the same type of thing taking place, where this will be a 4th grade activity bag, and they'll know which grade will be there. Assigned seating is going to be important. So there's a lot of different things that are part of that plan, but it's definitely going to be a challenge, because most humans are social beings, and they want to interact and get along and communicate, and that'll be something we'll have to monitor and watch.
So one of the things you talked about was that it has to be a fluid situation, and so Kansas City Public Schools announced this morning that they may be pulling their in-person option because of a rapid rise in cases. Is there a threshold for St. Joseph that you guys are looking at to say, like, we're gonna have to pull at this point if we get close to this number?
Pull what?
As far as your in-person option.
Oh.
Is there like a threshold where you guys are gonna start to look at switching to virtual if this
Sure.
continues upwards?
We'll probably have a better answer for that once we find out how many people are interested in being in person or people that want to be in the virtual academy. Of course, with anything, we want to make sure everybody's safe and healthy. And we also want to make sure that we're able to meet the needs of our students that come to school. So I don't have a perfect answer for that right now. That is probably one of those fluid things that once we get kind of a benchmark measure, we'll have a better answer for them.
Can you talk a little bit about why July 31st has been set as the online entry enrollment date, and just kind of like how that functions as far as like, you know, how that deadline is applied? So is it basically July 31st, that's it? If you want to enroll after that, you have to wait until the next semester, or how does that work?
Well, July 31st is the date because we have to also know how many staff members and students will be involved. So we had to pick a cutoff date. And if you go too much longer, it has an impact on human resources, it has an impact on setting up virtual academy, getting those staff members trained. So there really is no perfect date. And again, we're going to try to have it set as solidly as we can. But if something changes, then Dr. Williams and I will visit. If we need to make an adjustment, we will. But we also know that it has to be kind of like a freeway system. There has to be on-ramps and off-ramps. You just can't let everybody come and go as they want because that creates chaos and issues. So really what this benchmark is to give us an idea of how many people are going to be in the virtual academy, how many people are going to be in person, and then we can make some plans and adjustment based off of those numbers. If we waited too much longer, we don't feel like we've been able to do justice or do the right thing to be able to plan that way.
What numbers are you looking at in making these options and decisions? What have you been, are you looking at St. Joseph Health officials, Buchanan County? State?
Well, really, I'm on a weekly call with people and health officials and community officials, and so we're kind of monitoring that. But we also know that people are still moving. People aren't necessarily following all the safety guidelines and precautions, so that's something that we'll continue to monitor and measure. We're in touching base with our health officials. Maria's talking to them on a regular basis and making sure that we're trying to stay as current as we can, because what's happening here in St. Joe may be vastly different than what's happening in Maryville or Savannah or even some of our surrounding communities. And so what may apply to us may not apply to somebody else, and the same thing reciprocal on the other side. What they may be doing may apply for them and work for them, but it won't work for us. So we're trying to take as much information as we can, and being quite frank, that's a boatload of information, and to try to sort through that. And sometimes the information is somebody's opinion rather than fact. We are trying to follow health officials, science, guidance from our associations, and making sure that we're together and in conversation with other school districts. We're all going through the same process together.
Is there a certain percent of students you guys kind of need to opt out for and do virtual learning, so that way you guys can follow guidelines, social distancing guidelines in all the schools and buses? Is there like a 90% threshold? I heard
Sure.
that was kind of an unofficial number in the Kansas City area.
Well, I think just being realistic, social distancing guidelines are awfully difficult to have take place in schools. And so that's why I think, as Maria shared, we'll be expecting staff and students to wear masks when those social distancing guidelines aren't able to be done. And again, it really will depend on how many students do either opt in to come into our schools, or how many choose to stay home and go virtually. And so this is something that I'll just mention this. The virtual academy that's been put together, Dr. Williams talked about that, is leaps and bounds different than what we did March through May. Hopefully folks will go online and see exactly what that looks like. It is really a challenging opportunity, so it's not for everybody. But we also realize that some of our families need and want that in-person option, and so we'll monitor that. But we're also not going to be pushed into making decisions that we don't think are right for our students and their staff either.
I wanted to follow up on the issue of wearing masks. How does enforcement look like on that subject? I think there's been a lot of talk nationwide of just people who either don't want to wear masks or feel like they're not necessary? How does that dealt with?
Yeah, and that, even through our conversations, is one of those areas. Right now, we're saying we're expecting our folks to. We're not to the required component of that, but that could change, and that's what we need people to know. It really is about, from our vantage point, if people want to be in school, hopefully they will follow the expectations that we put in place, because it's not necessarily about me individually, it's about everybody else around me. And it is the divisive issue, and we realize that. Our goal is not to consequence and punish people, but we want to keep people safe. So that's kind of the guidelines we're going to follow right now, and then we'll probably have to be very bright lined on what that looks like when we get closer to school. Right now, we just hope people understand we're trying to get the information out there, but we're trying to let them have the opportunity to think and decide, and let them know that really our expectations will be that we'll be wearing masks when that social distancing component won't take place.
And for masks on that issue, is there an option for, or are you guys starting to line up maybe funds in case, you know, some of the students who are on free and reduced lunch or things like that that may not be able to afford a mask, that you guys have those kinds of options available for?
Sure, we're kind of walking through some of those scenarios right now. We have purchased masks. We also have the federal dollars that are coming to us from purchasing protective equipment and supplies. We also are going to be providing masks for all of our staff, the reusable, washable kinds as well, so that they'll have those. So we'll be trying to provide that. I think Apple is going to be trying to work through that process for our buses as well on how they can provide it. But we also want families to know that if they can go out and get masks, they need to go out and get masks and be ready to have that if they're going to be sending their children to school with us.
How difficult a process has this been? Just going through the process itself and then coming to this conclusion?
It's been real difficult because nobody's ever gone through this before. And so I think that our staff and our administrative team have really tried to do everything that they can, because the information changes so quickly. You know, we've taken a look at multiple different scenarios, multiple different options, and we felt like the best two options for our school district and our community was to either be back traditionally or virtually. And so that may work for us, and it may not work for somebody else. There may be some scenarios that you've all heard. You're going to have clusters of kids going on Monday and Wednesday, others going on Tuesday and Thursday. We just didn't feel like that was the right scenario for us to do. But again, as we go through this process, the information is coming at us so quickly and is changing so often. And so many people have opinions on what they think is what's right and what's wrong. We just really had to try to boil it down to taking what we believe is the information that's accurate from those officials, from the health department, from our associations, and then trying to put together a plan that we believe will meet the needs of our staff, students, and families.
If a student or staff member does test positive, contact tracing is something a lot of people are trying to figure out how to get everybody in contact. What does that look like for a building or classroom?
I'm going to have Maria come and touch base on that a little bit, because there are some guidelines that we'll be following that are from the health department as well.
So if a student or staff member tests positive at school, what we will do is we will mask that student up if they don't have one on, and then we will quickly try to get a hold of a parent, just like we would with any other illness, and get that student home and to seek care from their primary provider. We will then be in contact with our local health department. We've kind of got a chain of communication, and we will be in contact with them. Several of our nurses have already gone through a contact tracing class with our local health department, but before school starts, all of us will go through that, so we can kind of start that process before they get into action. So we'll communicate with them, we'll start the contact tracing process. Again, that is why we are more than likely having the seating arrangements, even the seating arrangements on the bus, things like that. So we will know who these students are around, and that makes that group a little bit tighter, a little smaller, and that way we may not have to shut down an entire district. We may shut down a classroom for a day or two for cleaning and things like that as we get a hold of folks. So we've already been thinking that through, and we've got a plan in place, and it might be clunky at first, but we know that we've been practicing scenarios, and so we will make it work and do the best that we can and partner with our local entities. Because it's not just a district issue, it's our community issue. So we partner and get together often to keep sharing communication and information. Did that help?
Yeah, thank you.
Anything else?
Well, I had just a follow-up question. I don't know if you're the best person to ask about this, but what happens for, I guess, the people around the student who tests positive or a teacher who tests positive? Do you send the whole class home? What's the procedure for that? I know the student has to stay home.
There's guidelines from the health department, and basically you have to take a look at who's been around that child. Their recommendation is if it's been for more than 15 minutes, if they've been within 6 feet or more, those families will be contacted, is my understanding,
Yes.
correct me if I'm wrong. And so then they'll follow health department guidelines as far as how long do they have to stay home and be monitored. The part of the issue is just because you've been exposed doesn't mean you'll get it. And so you just can't say to somebody, hey, you've been exposed, you now have to shut down. There's certain guidelines that we'll be following. Am I saying that correctly?
Correct. We will follow the process, and we have a nurse in every building, and they will take that lead and work with me and work with the health department, work with our communications and things like that. So as he said, just because there's been some exposure doesn't mean that there will be illness and things like that. So we'll approach each situation individually and work through that with our team that is trained and prepared to handle such situations.
And even if your student isn't in that class, maybe they're in 5th grade and this is in 3rd grade, will the whole school be notified? Are you guys going to do just kind of district-wide notification?
You also have to remember, we can't give specific names of students,
Yes, right.
but we'll be trying to do as much communication as we can so that people know there's been a case. What we'll probably start out with is those that are in closest proximity to that child and make sure, or staff member, that they've been communicated, and then it'll probably roll out from there because we want to make sure the ones that are exposed to it the most closely are notified first. But my guess is, and I'm looking a little bit at Eileen, the whole school at some point will probably get some type of notification like, hey, there was a 2nd grade student that has had a confirmed case. Again, here's our protocols, here's our procedures, here's what we're doing. We're just making you aware. Because as we all know, people want to be communicated with. They just also need to know we won't be able to give specific details on name of the student or anything like that, because that's a violation of multiple issues.
Would that send the potentially exposed kids into virtual learning settings then if they have to sit out for a couple of days, or for the kids that may have been exposed but not have?
There's a couple of possible scenarios that maybe Dr. Williams may want to come up and answer this if I don't answer it quite correctly. But it would be probably a remote learning setting. There's kind of 3 different scenarios. If you go in person, you're traditional. If you go virtual, you're in that for the length of that semester. If something happens and we have to shut down a classroom or a building, we could go to what's considered remote learning, which is kind of a sister of virtual learning. It's based off of the same classes that were developed in design, but that classroom teacher can then be kind of piggybacked onto that virtual learning classroom setting and then use that same type of technique that's being done in the virtual setting. So it's kind of that's a plan B. If something happens, then you shift to plan B and you can go to remote learning for a short period of time.
That's exactly right. And I can talk about this more maybe individually, but I like to think of it, and I've explained it to several groups, as a brick and a click. So if you are a brick face-to-face student and we happen to have an exposure, think of it like if you're going homesick or we have a snow day. And that would be a remote learning situation where the teacher, who is the face-to-face teacher, would still lead the instruction. If you go to the virtual academy, that's the click side. You're fully virtual for that semester. So that's a different, you're always learning online with the same teacher that is your virtual instructor. So they're 2 different groups. And to keep them separate, I understand, is kind of difficult. But if we do have a classroom or a group of students who go home for remote, or we have a closure for any reason, if it's a snow day or a water main break, if that's a remote situation where the teacher, who is their face-to-face teacher, would then assist in that delivery through any of our learning management systems.
And kind of going on to that, if we're communicating for these parents in the school district and we want them by July 31st, if, let's say do they have to say yes in person, even if maybe they're not sure yet? I mean, what do you advise parents to do if they're kind of in the middle, they don't know where they stand? Do you tell them to go ahead and enroll in person and then tell you later? Is there?
I think it's really important that you make a decision, the best choice for your family, whatever that looks like for you. And if there are questions, we're all willing to answer those, but we really need the best and most informed choice that a parent and a family can make. As Dr. Van Zyl indicated earlier, we also need to make decisions for our staff. So if some of them are currently assigned to a physical building and they need to make the transition to virtual instruction, we want to give them time to make, to get their things packed and to have the ability to transfer and to get all of that other training done. So there are several moving parts where that is concerned. So the more we know by July 31st, the better it is for us and for our schools in order to plan some of those other pieces.
I just would encourage people to take a look at the plan and take a look at the questions. And if it answers their question, then their level of comfort is such, we really do need them to try to make a decision on what they're going to do, because it does domino into so many other things related to staff and what else we're going to do. If we could have waited longer to let people make a decision, we would have, but it really puts our staff in a bind if we're going to have to transition somebody from a regular classroom to a virtual learning setting. Or we need to know how many kids are going to be in the classrooms, back to the question that you had before. If we are down 100 third grade students, well, that has an impact on class sizes and how we can then social distance and what that will look like in a school. It also will help our administrators be able to plan for what does lunch look like, what does PE look like, what does recess look like. Even though we have general guidelines and plans for all of that now, if you have a smaller number of students, it makes that different. If you have a larger number of students, it makes it different also. So that's why we had to pick a date. I'll never tell you it's a perfect date, because some people are going to say, well, it's not enough time. Some people are going to say, why didn't you wait longer? That's why, because there's still so many other moving parts we have to get put together. Anything else? If not, again, thank you. We'll hang around if you have individual questions, maybe visit with Eileen on if there's somebody in particular that you want to talk to, and then she'll get you set up. But thank you so much for coming. We appreciate it.